So the Diversity Institute, along with the Future Skills Center and the Public Policy Forum, has recently done a study of small and medium enterprises and future skills. I'm going to present the results of this study along with some new research we have on the impact of COVID on SMEs because it's an important part of our recovery. We know that SMEs employ the majority of Canadians. We know that historically they have reported skills shortages and gaps. We also know that COVID will increase the need for skills and will require reskilling, upskilling, and tapping into new pools of talent. We also know that women and diverse entrepreneurs are disproportionately affected by COVID and have to be part of the solution. More research is needed in order to build a truly inclusive innovation system. So when we look at the pre-COVID world, we know that 39% of SMEs reported acute skills shortages. These skill shortages have been so severe. Many have had to have employees work more hours. They've had to increase wages and benefits in order to attract talent. And some say that it has limited their growth or had an impact on their ability to be competitive. When asked what skills are needed, many talk about soft skills, and they also report shortages of engineering talent, apprentices, and so on. However, at the same time, we know that many SMEs may be looking for skills in all the wrong places. We know, for example, that job applicants with foreign-sounding last names, whether they were born and educated in Canada or not, were 20% less likely to be called for an interview in large companies and 40% less likely to be called for an interview in SMEs. We also know that 40% of internationally educated engineers are underemployed. So part of the skills gap problem requires us to address both the supply of workers, but also the way in which employers find them, train them, and include them. Along comes COVID, which has had incredible disruptive effects on businesses of all sizes. It's resulted in underemployment and unemployment of a very large percentage of Canadians. We know that startups have seen their revenues decline. Many have closed their doors altogether. On the other hand, some have pivoted, some have innovated, some have started new lines of business, and many have moved very quickly into the digital world. When we look at COVID impacts, the structure of SMEs is critical to understand. So COVID has most affected smaller SMEs, those with no employees, 1 to 4 employees, 5 to 19 employees are far more impacted than larger companies. We also know that in order to maintain our economic growth and social development, we have to support SMEs at every stage of their development. If we don't support early stage companies, we will see the results for years to come. Inclusion is critical. Women-led businesses account for a much higher percentage of the growth in entrepreneurship in Canada. We know that immigrants are more likely to start businesses than Canadian-born workers. And yet the sectors where we see women, where we see racialized people, where we see Indigenous people are most acutely affected. 90% of accommodation, food services, arts, healthcare, and education report significant job loss compared to only 50% of agriculture, forestry, fishing, ICT, etc. We also know small businesses, micro businesses, are the hardest hit, and those with limited savings and credit, often, which is the case with new startups, are particularly vulnerable. Women-led enterprises are almost by definition newer, smaller, and more fragile. And yet most of the programs we have seen emerge to address COVID are targeting SMEs with employees. Women entrepreneurs are more likely to be self-employed. For example, they account for 15.6% of SMEs with one employee or more, but 38% of self-employed Canadians. Women are also underrepresented in the tech sector, and they are being crushed by the burden of unpaid work and childcare. And we see this come out very clearly in the gendered differences in the impacts on revenue due to COVID among SMEs. So women have seen a much higher rate of revenue decline than men in their businesses. The other thing that I find particularly ironic is we know that women are leading the battle against COVID, that most of our chief medical officers of health are leading COVID through the crisis, and in fact, worldwide, many of the leaders doing the best job in fighting COVID are women. And yet, when it comes to the discussions of recovery, women are absent. They're not being consulted. They're not part of the framing of new programs. And the preoccupation with science, technology, engineering, and math, with led businesses, with venture capital, the focus on financing, and so on, exclude women, because the businesses, as I said, that women are more likely to be in are not likely to be in tech, are more likely to be in services, more likely to be self-employed, and often they're excluded from both the programs and the dialogue around what is required. We need more research. We need to better understand the dimensions of skills shortages. We need to look at the impact of investing in skills. We need to know what works and what does not work, particularly with respect to tapping into diverse populations. We need to leverage diversity and inclusion to expand access to talent, skills, and innovation, and we need to understand better how to help SMEs do this. We need to ensure that the voice of SMEs is heard in the discussions of the future of work and the COVID recovery, and we particularly need to make sure that businesses led by women and other diverse groups are included. We need to look at what skills and capacity are needed in the new world to ensure that companies have what they need to recover, as well as the talent they need to do it. And inclusion is clearly critical to bridging the skills gap and to advancing social and economic growth. So we need to think, as we think COVID recovery, we need to think inclusive innovation. Thank you very much.